This is Dr. Raj, your friendly Beverly Hills orthopedic surgeon who treats sports injuries and joint pain. I'm here to protect you from yourself and keep you out of the operating room. We have Amber on the line today. So, hello, Amber. How are you?
Good. I'm fine. How are you, Dr. Rajiv?
I'm very good. So, tell me, how can I help you today?
Yes, I was wondering, Dr. Rajiv, I know that, it sounds like, you try to err on the conservative side, but I have a question. This is regarding extended limb lengthening procedures.
Okay.
Do you do, I imagine you're familiar, with the procedure. Have you done any yourself, and how successful are they really?
So, what context is it for? I mean, is this for yourself? Have you, or a friend? Did they have an accident?
Well, I read about it, in terms of people that have a chondroplasia, and
okay.
I think then and I was just wondering, even for people like myself who are of normal height. Well, let's say you wanted to acquire a few more inches. Is this something, that you as a surgeon, can do, which is one question, and do you recommend doing it? Because I did read it's quite invasive and it is painful.
Yes, and that it is. So here's the deal. I mean, to gain a few inches, if you've got to always have realistic goals. I mean, you have to look at how is this going to change me. I mean, I have situations where people have had fractures and they have leg length discrepancies. When they have one leg that is 4 inches or 3 inches shorter than the opposite one, it's going to change them significantly because you're going to equal leg lengths. You're not going to overload the knee or the back because of that extreme leg length discrepancy. And when you walk and get around, you're going to walk normally with equal leg lengths intuitively. Now, when it's with someone who just wants more height, the question always is, will you be happy at the height you're at? I mean, how much more do you realistically want? Because there's a limit of how much leg lengthening you can do because it is a very painful process. On a simplistic basis, we cut the bone. And then there's multiple ways of doing it, but we cut the bone, and then we have an external fixator on, and we slowly distract the leg over time. And as you distract the leg, what do? You stretch your ligaments, you stretch your tendons, you've got hardware in, and your hope is that bone in between forms and heals properly. And that's why we slowly do it. So it's a slow, long, painful process. Now, the question I have, Amber, is if you're doing this, and you have achondroplasia or you just want to be taller, are you going to be happy with 2 more inches? Because usually what I find is people who have those 2 inches want 2 more. There's a limit where you have to realize, how is this really going to change my life? And then there's the pros and cons is, there's always a risk. There's a risk that these bone won't heal in between. There's a risk that you may have a complication, pin site. You may have chronic nerve damage from this lengthening. So you have to take that into consideration too. So it is a whole psychological breakdown when someone's asking for X number of inches because there's a limit in saying, you have to realize what level will I be happy at. Make sense?
Right. No, it does make sense. Dr. Rajiv, also, are there external scars from such a procedure?
Yes. You always trade off a scar, and there's a scar because you need to cut the bone. They're not big scars, but there are definitely, and there are pin-type scars. So, if you do it with the external fixator and then the distraction method, that's the least invasive method to do it. Different old-fashioned methods is I could cut the bone obliquely, stretch it out, put screws or a rod in, and get it done right away and get you 2 inches, but that's a much bigger scar, and there's always a risk of non-healing.
And how long is the recovery, approximately? I mean, people are different in terms of their, pain tolerances and the way the body, comes back to, where it previously was.
And remember, every condition is different. So if you're doing it for achondroplasia versus a post-traumatic deformity versus someone who just wants to be taller, recovery varies because essentially we're recreating a fracture. So even after a fracture, we all heal differently. I'll give you the quintessential answer every orthopedic surgeon will tell you: 6 weeks. So 6 weeks for healing, and another 6 weeks, 2-3 months for physical therapy, because now you have to work on those tendons that are lengthened, those muscles that are lengthened, dealing with the spasms. So the answer is probably 3 to 6 months in total.
Well, that's quite, something to think about.
Yes.
It's
you
no
always
easy
have to
procedure.
break it down, Amber, and say, will I actually be happy with 2 inches? And when I get those 2 inches, would I say to myself that I want 2 more? Where are you actually going to be happy with and what your goals are? That's what counts.
Yeah, that's
okay.
the point. And the other thing also, Doctor, is under any circumstances that that one would go for this procedure, is it almost always never covered by insurance?
It's
if you're familiar with that aspect of it, I'm sorry.
Well,
if I'm getting far afield from the medical, but that's another thing I read about.
I'll give you a quick answer on that. If it is a person who has a leg length discrepancy and one side shorter because of a trauma or a fracture or an infection, yes, insurance will cover that. If it is for cosmetic reasons where you want to be taller, that's unlikely insurance will cover that.
Mm-hmm. Oh, okay, yeah, that sounds reasonable.
Okay? It's great talking to you, Amber. Good luck on your
Thank you very much, Dr. Rajiv, and thank you. It was a pleasure.
Okay. So, getting back to weekend warrior injuries, okay, here's the deal. Deal. Deal is one of my favorite words. Prevention, okay? Number one. Before any workout, what do we do? First of all, realize your limitations. If you have an unstable knee, are you going to do jump squats? No. If you have a bad shoulder, like me right now, are you going to do heavy shoulder presses? No. You're going to modify your activity accordingly. Use common sense, or use a certified trainer or an orthopedic surgeon who knows fitness like myself to guide you. Meaning that I'm not going to tell you not to do shoulder presses. I'm going to tell you to do drop-down sets, meaning a lot lighter weights, drop down, and you will still build up the same bulk and strength. Yes. Number two, realize as you get older, your joints are worn out. So you really don't need to do impact activities. Number three, you can do cyclic activities, and you have to acknowledge if your weight's too much, you probably don't want to take those extra 10 pounds, which can translate to 5 times your body weight, and pound your knees that are worn out. Look at what your gains are. Number three, stretch. Stretch before, stretch after. So much more important as you get older. Or you will be that person like Kobe Bryant who will tear a tendon, be addicted to pain meds, gain weight, and your life will change. The simple stretching. And number four, warm up before any activity. That's a walk or a run or a jog. Get blood flow going. Very important, okay? These are the 4 tips from Dr. Raj to avoid injuries that can destroy your life. This is Dr. Raj at the Lifestyle Talk Radio Network. I am talking about weekend warrior injuries, destroying your life, killing you quickly, making you suffer, putting you through a lifetime of pain and suffering. I'd love to hear your story, so you can call in or contact me at drhsandkne.com. Stay tuned when we talk about the most extreme weekend warrior injury I've ever seen, and a colleague of mine who became paralyzed.
In 1949, Scooter hopped on the horn and called up Geico to save himself some cashola.
In 1986, Clarissa gagged on a spoon when her